Hi, everyone. Welcome to MediMobile's LinkedIn Live. I'm Christy. I'm excited to be here with Lauren Hall, MediMobile's Director of Business Development, to talk about the future of automated medical coding in 2025. We'll cover how MediMobile's AI solutions Genesis is transforming workflows, cutting costs, and bringing in more revenue. This is your chance to get questions answered live. Feel free to drop your questions in the chat at any time. We'll answer as many as we can. Now let's get started. What makes Genesis different from other tools for medical coding?
So one thing that sets MediMobile as a whole apart from other solutions similar is the ability to process the medical documentation feeds, the medical decision-making feeds that we receive from facilities. We then take the feeds and information within them to then populate the CPT and diagnosis codes based off of what the providers have documented. We receive the documents in real time and our coding happens in real time. So it's a very fast turnaround. And then of course our accuracy does beat out others in the industry. We do currently have a 95% accuracy rate with Genesis.
That's awesome. Okay. And how exactly does Genesis utilize AI?
So Genesis utilizes AI to code the documentation that we receive from the facilities. So the providers go into their hospital's EMR, create their notes, and those notes are then sent to us through an integration. And our system then reads the document and the AI provides the CPT and diagnosis codes found within the documentation.
Awesome. Seems pretty seamless. What are the biggest benefits of switching to automated medical coding?
So time savings is huge. Your increase in revenue and the decrease in denials are just some of those large benefits. So for example, providers are saving 10 to 20 hours a week because they're no longer having to search for CPT and diagnosis codes. Those are added for them and they can simply hit approve and accept the codes that Genesis has added to their charges. Your billing and coding teams are saving 75% of the time previously spent reviewing documents and then coding them for providers, or even reviewing the codes that providers have added themselves. So you've got your 10 to 20 hours that your providers are saving, which gives them back time to spend more time with patients or even get home a little bit earlier because we know that they have so many patients to see. So giving them that time back is very important. Then for your builders and coders, that time saved allows them to focus on tasks that maybe previously didn't get attention. So they're able to reroute that time. And then, of course, that increase in revenue is because we are populating all of the indicated billable document types, whereas when populating off of ADT feeds, that is dependent on that registration feed. But when you populate off of your documentation, you are ensuring that every billable encounter is accounted for, which increases the revenue, along with the coding that takes place with our AI, always ensuring that the highest level of coding is provided for the services. And then that decrease in denials, that's a huge one. We actually have one particular customer that has seen a 50% decrease in their denials just based off of the accuracy of our coding system. So when you think about the time spent having to reprocess denials, that time is eliminated as well.
Oh, that's awesome. What is it like for a doctor or a coder to use Genesis in their daily work?
So what's really nice about Genesis is we do have the option for pass-through, where if you want to completely eliminate charge capture from your provider workflow, you absolutely can. And how that works is that we go ahead and our system is set up for the AI to add the CPT and diagnosis codes. And instead of the providers approving those codes, they can flow straight to the coders. So you actually have an opportunity to completely eliminate charge capture from your provider's workflows. Now, if a provider does opt to utilize Genesis and approve their own codes, again, you get back to that 10 to 20 hours of savings per week because you're no longer having to search for the appropriate code. It's there for you to approve. In terms of your coders and their daily work, again, that time reduction is huge. So your coders are able to help focus on the improvement of documentation, and then there again, identifying tasks that maybe were neglected previously. So it can create such efficiency within organizations that entire tasks that were neglected before or other uses of time can be put in place.
Awesome. Yes, ma'am. How does Genesis work with systems that clinics and hospitals already use?
So I mentioned it briefly when we first started talking about the integration of the MDM feeds. So what we do is we work with the facilities to integrate with them to be sent the admit discharge transfer feed, the ADT feed, the registration feed, as well as the MDM, the medical decision making feed, or the notes feed. So we work with the facilities to set up an integration where we receive the data and then we populate it into our system. So not only do you have the documentation at your fingertips, but you also have the patient demographics and insurance information right there. And again, that's all set up with our integrations team and with the facilities integrations team.
Awesome. Okay. What kind of specialties currently utilize Genesis?
So we have several specialties utilizing Genesis. We have hospitalists, we have radiologists, we also have cardiology, and we have a couple of new specialties coming on. But the predominant specialty right now is going to be hospitalists.
Awesome. Okay. What happens if a doctor's notes are incomplete or unclear?
So, if a provider lacks maybe specificity or not enough detail to accurately code a diagnosis, what happens in our system is those items are highlighted orange, as you can see on the screen. And what that's asking the provider to do is add additional specification. And we do offer refinement options, and that is not only with our AI, it's with any of our other platforms as well. But they have the opportunity to refine and provide more specificity, of course, possibly resulting in an increase in return.
Perfect. Okay. Can you share how much revenue increases and how much time a single clinician can save by using Genesis?
Yes. So, revenue, again, it will depend upon the size of the organization and the amount of claims. But for example, some of our current customers have seen upwards of a 15 to 20% increase in their revenue. And of course, putting a price tag on that time spent not only on their on the time spent coding the charges, but again, those denials are huge. So they're no longer having to spend time on denials, which you've spent time processing it the first time, you've spent resources processing it the first time, but then it has to go through the entire process again. So you've got cost savings across resources as well as revenue increases. And then for your providers, like we've talked about, it's about 10 to 20 hours per week because they're no longer having to search for those codes.
Understood. Yes. Is Genesis scalable both for small practices and large healthcare systems?
Absolutely. So we've onboarded both large enterprise systems as well as single provider groups. So just because you're a huge system, don't be afraid of implementing Genesis. We work with the teams to ensure that the documents are flowing and that our system is identifying any nuances that your team may have. And then for our single doc groups, of course, that's a little bit easier because you're only dealing with one provider creating a certain set of documents. But we do it all across the board, single doc groups or large enterprise systems.
Awesome. Okay, great. Thank you for all that information. Now let's move over to some questions from our audience. Our audience would like to know, is Genesis affordable for small practices?
Absolutely. So, one thing we pride ourselves on, and I'm glad to talk about this, I talked about this with a small group the other day. We pride ourselves on serving not just large enterprise organizations, which we definitely value, but also smaller practices because every provider, every billing group deserves to see those efficiencies. because ultimately, the more patients you're able to see, the longer you're able to care for your patients, the better. So we do ensure that it is affordable for all size practices. And of course, we do have our standard pricing, but we work with people all the time on that.
Awesome. Okay. Can Genesis work alongside human coders, or is it designed to replace them entirely?
So, as we know, coders are highly valued. Their knowledge is invaluable. We have coders here on our team, and just to sit there and listen and see that they can read a provider's document that I'm not even sure what's in it, and they can provide those codes, you can't replace that with AI. So, Genesis is intended to work alongside those coders and make their workflows just a bit more efficient, and provide them with time to spend on those more complicated cases. So, AI is not here to replace jobs, it is here to create efficiencies and provide additional resource time.
Awesome. Okay. If a clinician disagrees with a suggested code, how easy is it to make changes or provide feedback?
So it is the click of a button or the tap of a screen. If a provider disagrees with the code, that a provider or a coder. So if pass through is turned on, the providers are not seeing Genesis, the coders are. So either one, if they disagree with the code, they can tap that change button right next to the code and make those changes. They also have the ability to remove the codes completely. And what happens is our system is identifying whenever those changes are being made and tracking that. So then we can go back to the practice and have that conversation about why it was possibly changed. And we can provide education on where our codes are coming from, which also includes our charge grid that's available for providers, just kind of giving them a little bit of feedback on their documentation. So again, it's very easy to change or remove codes added by Genesis. They are not set there without the ability to remove them. But we are also tracking all of those changes to have conversations with the team.
Awesome. Okay. And does Genesis provide reports or analytics to help practices monitor performance and identifying trends?
Absolutely. So, like we just talked about, the goal is for provider documentation to be as accurate as possible and to match those CPT and diagnosis codes that are added to the bills, again, to decrease your denials. But also make sure that the highest level of revenue is being collected. So we do provide reports on the codes that are being added to the encounters, as well as any changes that are being made, how often those changes are being made. We have an entire reporting suite for MediMobile users, and we do have a section for Genesis as well.
Awesome. Okay. And how quickly can Genesis process and code a patient visit compared to a traditional method?
So, like I said, we receive the notes in real time. We have providers that will finish their note on one screen in the hospital's EMR and watch it flow into MediMobile within seconds. So again, those documents flow into MediMobile within seconds, and you can expect to see it coded within about a minute. So when you think about the process of having to Google the appropriate CPT and diagnosis code to add it even into a charge capture platform, you've reduced that time by 10 to 20 hours a week. But then if we look at those that are using paper, you've not only eliminated the search process, but you've also eliminated the process of handing that piece of paper to someone that then has to manually enter it somewhere where it goes to the next department. So again, there's a huge cost savings, which allows you to get your revenue back faster and collect more revenue.
Awesome. Okay. Lauren, can you tell us how someone can get started with Genesis if they'd like to automate in 2025?
Yes. So all you have to do is go to medimobile.com and book a demo. You can feel free to reach out to Christy or myself, and we'd be happy to answer any of your questions.
Awesome. Thank you for your time today, Lauren. And thank you all for joining us. We hope you're leaving with valuable insight into how automation and AI are shaping the future of medical coding. A big thank you to Lauren Hall and to everyone who participated with questions. If you are ready to take the next step and want to learn more, don't forget to check out our website or book a demo with us at medimobile.com. Again, thank you, and we'll see you at the next LinkedIn Live. Have a great day.